Good afternoon, everyone. This is Jean Chimino from the National Resource Center for Health and Safety in Child Care and Early Education. We're going to go ahead and start the webinar. Thank you so much for joining us for the impact of environmental health in early care and education settings. We are very excited to partner with Children's Environmental Health Network to provide this webinar for you. We have, in terms of registered participants, we are happy to say that we have 19 states represented and also Washington, D.C. So thank you all so much for taking time out of your day to join us. We are going to have the presentation. Throughout the presentation, if you want to ask questions, you can do so by typing into your chat box, which should be at the bottom right hand of your screen. And at the end of the presentation, after both Carol and Linda present, we will do our best to answer your questions as time allows. What I'd like to do is just go over briefly who our presenters are. We'll give a brief bio, and then we'll hop right in. Carol Strobel is the Director of Training and Policy at the Children's Environmental Health Network. She has worked with the network since 1996, gathering extensive knowledge of pediatric environmental health and the real-world implications of the emerging scientific findings of this field. Previously, Strobel served as the Director of Intergovernmental Affairs at the National Highway Traffic Safety Administration, as the Legislative Director for a senior member of the U.S. House of Representatives, as a press secretary to a Midwestern governor, and as a Director of Federal Affairs for a National Highway Safety nonprofit organization. And Carol, we're just delighted to hear from you. After Carol presents, Linda Satkowiak, who is also here at the National Resource Center for Health and Safety in Child Care and Early Education, will be presenting. And Linda has worked as a pediatric nurse for Children's Hospital Colorado for almost 20 years here in the Denver, Colorado area. Until July of 2013, she served as the Healthy Child Care Colorado coordinator, supporting child care health consultants and child care staff as they work to provide healthy and safe environments for children and families in their care. She has also had extensive experience serving children with special health care needs in early care and education settings, and she has worked as a child care health consultant for Head Start and Early Head Start programs. Linda now works on a part-time basis with the NRC as a content manager for Caring for Our Children 3rd edition. So at this point, I'm going to turn it over to you, Carol, to start the webinar. Thank you.
Great. Thank you very much, Jean. I hope everybody can hear me okay. And I appreciate that, that kind introduction. And we're also very excited about this partnership of working with the NRC. And I'm going to just take a minute to talk a little bit both about the network and about one of our programs, which is Eco Healthy Childcare. The network is a national nonprofit that was created over 20 years ago to protect children from environmental
Carol, I'm
hazards.
sorry, I may interrupt you, please?
Sure.
Could you turn up your volume?
Oh,
or get
okay.
closer, I'm sorry, get closer to your microphone. We have someone who's having a hard time hearing.
All right.
I apologize for interrupting.
Not at all. Okay. Is this better? Is this better? Okay. I apologize for that. I appreciate you letting me know.
Thanks, Carol.
Sure. The network is a national nonprofit organization which was created by pediatric researchers and clinicians who were concerned about whether or not we were adequately protecting children from the environment in which we live. And we're going to talk a little bit more about that later. But I mention that because everything we do is health-based and science-based. So a lot of things we're going to be talking about are all come out of peer-reviewed science that's emerging in this field. And our objectives today are to just introduce you to the concept of children's environmental health and what some of the emerging science is showing about the impact of on children's health and development and their environmental exposures. And we're also then going to give you some specific tips, things that you can do to building on this emerging knowledge and point you toward directions of resources, science-based free resources where you can do more. And then Linda with the NRC is going to be talking about partnerships that we're working on with them to also address this concept. And so I begin by saying why. Why are we here? Why is there a field of children's environmental health? And I think we all know that when we look at children and how they develop, there's many, many different factors that affect their health and future and their ability to learn. And each factor can play an important role. And so we're going to talk about environment as one of those factors, and how maybe there's a lot more happening in a child's environment that affects their future in ways that we might not have been aware of in the past. So first of all, why are we focusing on children? Well, as the saying goes in the field of pediatrics, children are not just little adults. That's why there's a field of pediatrics. So if you think for a moment, what are some of the basic reasons why children are different from adults? And you'll probably come up with things such as this. That pound for pound, they eat more food, drink more water, and breathe more air than adults. So what that means is that, for example, if there's a contaminant in their tap water, like lead, when a toddler drinks a glass of that water, they will have a higher level of exposure to lead than an adult drinking that same 8-ounce glass of water. So that means if there is a contaminant in their environment, for those reasons alone, they're likely to be exposed to it at higher levels than an adult will be. And then additionally, for how many of us is it normal behavior to explore our world by putting everything in our mouth and spending several hours every day on the floor? But children have different behaviors than adults. So that's another way that children are exposed to things differently in their environment. So if, for example, there are pesticide residues or lead dust on the floor or in carpeting, the child that's crawling on the floor is going to be exposed to those at higher levels than will the adults that are also in that same room. And then the job of a child is to grow and develop. All of their systems are immature. And what children are doing as they are growing is their systems are maturing and developing. And what we now know is that as these systems develop, they can have windows of vulnerability where they can be harmed in ways that an adult, in their similar system in an adult, would not be harmed. So we focus on children because children have unique vulnerabilities to chemicals in their environment and other kind of environmental exposures, and that an exposure that for a child, exposure that for an adult may cause little or no harm, may cause lifelong harm to a child. And that's something that we certainly have learned when we look at exposures to mercury or lead or some other chemicals. So that's why we focus on children. And then why are we talking about environmental health? Well, there's a lot of different definitions of the word environment and of environmental health. And with our organization, we look at a broad array of different factors. And for us, we often begin, but don't end with, the chemicals in a child's environment. Children growing up today are exposed to many chemicals that didn't exist 50 or 100 years ago. There are now over 80,000, 85,000 chemicals that are used in commerce today. And unfortunately, the way that we currently regulate many of these chemicals is that we don't really regulate based on health. We don't have a lot of information about what the impact is on human health of these chemicals. And we have kind of a paradigm for many chemicals that they are assumed safe until proven otherwise. And although we don't have a lot of information about these chemicals, we find these chemicals not only in our environment, but in our bodies. For most of us, if we were to have our bodies tested by a laboratory, for example, by looking at blood and urine specimens, we would find trace amounts of between 150 to 250 chemicals in our bodies that didn't exist 100 years ago. And we're going to talk a little bit more about what that means, but I want to say at this point, we're definitely not saying that the mere fact that we find them in our body means that they are causing harm. But there are some really interesting scientific findings coming out that indicate that maybe we want to be a little more cautious about what's in our bodies. And although when we're looking at chemicals that are in use today, as I said, we don't have a lot of information about the impact on human health. But even when we do have information on the impacts of chemicals on human health, unfortunately, they're almost always based on what the impacts would be on a healthy adult male. And based on what I just said in the previous slides, that a child's developing system means that they can be vulnerable in ways that an adult can't be, that means that we're not really adequately thinking about or regulating our chemicals to make sure that they protect developing systems. So we're kind of at this intersection of what we know about children and how they develop, which has not changed for generations, with children interacting with an environment that's new for people. And so what are we finding? Well, I think we all know that there are a number of different kind of today's pediatric health challenges. They include asthma, where I think we all know that there is now many children who have asthma, and now about 10% of U.S. children. And we've seen great increases in things like learning disabilities and autism, and certainly some of, we don't know why we're seeing all these increases. These increases aren't due solely to changes in our population's genetics, because our genetics can't change that quickly. And if we're looking at what are some other causes for these increases, when you look at autism, as you can see in the slide, there's now 1 in 68 children is found to have autism. And there was a study done in the state of California where they were trying to understand how much of the increase in autism diagnoses was due to increased awareness or a broader diagnosis of autism. And they did a very rigorous review, and they found that 30 to 40% of the increase in the autism diagnoses was due to increased awareness or a broader diagnosis. But what that means is that 60 to 70% of the increase was due to some other reason, and they did not hypothesize why. And so we're not saying that this new environment and these environmental exposures are the sole cause for these increases, but we do know about asthma and learning disabilities, autism, and things like obesity. We know that they're multifactorial, that many factors influence health. And there's a saying in our field that genetics loads the gun and environment pulls the trigger. There may be the same genetic predisposition toward asthma or autism in our children today than there was 100 years ago, but 100 years ago there may not have been factors that then trigger that genetic predisposition. So we're not saying that environmental health is causing all these increases, but we do feel that it does play some kind of a role, and for us to try and understand what role environment plays. So I think we can say that environment plays some kind of a role, whether it's causing, preventing, or mitigating many health impacts. And then there's another factor of environmental health that we haven't talked about, which is we know that there are a number of environmental chemicals that exposure to these chemicals at one point in life can increase the risk of cancer in later decades. And since young children have so many more years of life ahead of them, of course, we would want to protect them from those kinds of exposures. So what is the science saying? There's been a lot of cutting-edge research in the last 20 years of looking at children's connection to environmental exposures, and research that hadn't been done before or that we didn't have the technology to do. And so I'm going to go over what some recent studies have shown, not so much for the outcome of any particular study, but I'd like you to be thinking about what do these studies show in terms of how vulnerable or how resilient a child's body may be to environmental exposures. For example, if I said we now know that air pollutant can cause asthma in children, you probably say, well, that would make sense. And then we've found studies that have shown that air pollutants can cross the placenta and can harm not only the respiratory system of the child, but even can cause DNA damage and can be linked to birth defects. And there's an air pollutant that has been found to increase the risk of SIDS. And even in older children, 8 or 9 years old, studies have found that air pollutants can harm their lung function, where before this, pediatricians thought that even at that age, a child's respiratory system was pretty resilient. And then 3 or 4 years ago, there was a really interesting study, which is still ongoing, where researchers are tracking close to 300 children in Manhattan, where they enrolled the mothers while they were pregnant. And they took many environmental samples, like in the children's homes, and the mothers wore air samplers while they were pregnant. So they got very good data on what these children were exposed to environmentally. And they've been watching these children as they grow up. And they found that, surprisingly, that even when they corrected for every other factor that they could, they found that a child's exposure to a very common air pollutant in the womb led to a lower IQ and poorer working memory at age 7. And this was a pretty surprising finding. I don't think that most people thought that that kind of prenatal exposure could really affect IQ. So we think that these studies as a group point to that we need to consider that children and their developing systems could be much more vulnerable to harm from environmental exposures than we might otherwise have considered. So given that kind of cheery news, so what do we do? So we begin to think about where do children spend time and how can we protect them from environmental exposures that we know or that we have good evidence to think may be harmful. And we're seeing that different kinds of experts and institutions are acting on this. The American Academy of Pediatrics now recommends that you prevent children's exposure to pesticides whenever possible. The American Lung Association and the American Academy of Pediatrics also recently went on record discouraging unnecessary exposures to chemicals that you don't really have to be exposed to, such as fragrances. And then also we can see in caring for our children where they've adopted a range of standards on environmental health that help child care professionals to better understand how they can protect children and minimize exposures. And we're talking about these environments clearly because we know that child care and early learning settings are where millions of U.S. children spend many, many hours of their time. And thus that's thinking about that environment and what children are exposed to is very important. One of the reasons that the network is involved in this is because a number of years ago when we began looking into this field and interviewing people and doing some studies, we found that it didn't seem as though there was much awareness in this field of this emerging science about the connection between environmental exposures and children's health. And there was not much happening. There was some happening, but not a lot happening in this field. And so that's one of the reasons why we got involved and are now managing the Eco-Healthy Childcare Program. And there have been some other aspects of progress, some of which we're going to talk about a little bit later. But we're working in this field to try and increase awareness and encourage the adoption of best practices so that the professionals who have such an important role in caring for and raising your children are aware of this science and can use it to help protect the health and future of the children in their care. So that's the overview that we promised earlier about what we meant by children's environmental health and kind of what science is showing. So you have this information and you can think, okay, so you've given me a graduate level course in about 10 minutes. So what do I do with this information? So I'm going to go over one particular area with some ideas of what you could do, and also point you to some additional resources. So we're going to talk about air quality, and the first thing I'm going to be talking about is indoor air quality. A lot of times when we talk about air pollution, people think about outdoors, and outdoor air pollution is important, and there are things that you can do to protect children, but a lot of people don't think about indoor air quality, or what they can do about it. I think most people know that clean air is necessary for good health, that harmful air that it has pollutants in it can harm health. And the EPA says that indoor air can be more seriously polluted than even the worst outdoor air. There is no real indoor air quality standard, so there's no way to say whether or not a facility has healthy or unhealthy air. But we do know that we find a lot of pollutants indoors, and that since most of our time is spent indoors, that indoor air may be an even greater health risk than polluted outdoor air. And then, of course, there's the issue of asthma. As we mentioned earlier, there are many, many children with asthma, and poor indoor air quality can worsen asthma, can trigger asthma attacks. So indoor air quality is particularly important for children with asthma or respiratory problems. And there are studies that show that poor indoor air quality harms a person's ability to perform mental tasks, to do the kinds of things in a school classroom or in a early learning setting, where we'd want children to do well. So poor indoor air quality is scientifically shown to have an impact on that, and science has also shown that when you improve indoor air quality, you improve health, but you reduce absenteeism, and things even like test scores improve. So there's a number of different sources of indoor air pollution, and before I put up my examples, I'd like you to just take a second to think, what might be some sources of indoor air pollution, and particularly what might be sources of indoor air pollution in my child care facility. So here are some examples that we've compiled. I hope that some of these came up for you when you were thinking about them. At the top of the list, what a lot of people don't think about is ventilation. We have, over the last several decades, we have made our buildings tighter and tighter, which is very good. It's very good for energy efficiency. It's very good for not wasting energy. But what that means is that it increases that means that when we bring something into a facility, if we bring in some kind of chemical, that means that chemical is going to linger even more, because you might not have a lot of air exchanges, you might not get a lot of fresh air into the building. So ventilation can contribute, and even poor ventilation can even cause poor indoor air quality. And then if you have things that burn, if you have a gas stove, a gas furnace with a pilot light, or even candles, you can get byproducts from burning. And then, of course, if you have things like mold, that's a concern. If you have pests, we know they can be asthma triggers, but also improper use of pesticides, and bringing pesticides inside a facility and using them also contributes to poor indoor air quality. And then how we build and furnish our homes. Like when we paint our walls, we often use paints that emit gases that can linger for a long time. And then there are cleaning products and fragrances, and radon, and art supplies, and also if you have poor outdoor air quality and it gets in the building, that also can contribute to poor indoor air quality. But there are things that you can do, and we are going to go over some specific tips. And of course, at the top of the list is smoking. To not allow smoking, not allow secondhand smoking, and even trying to avoid third-hand smoking. If, for example, if staff smoke outside of the facility, We recommend that they, for example, if they're going outside to smoke, that they put on a smoking jacket while they're outside while they're smoking, and then they take off the jacket before they come into the building, because they can bring in smoke residues on their clothes. And then some of the things we talked about earlier: ventilation, maintaining your heating, ventilating, and air conditioning system, such as changing filters as you need to do that, and controlling dust and allergens, and using what we call HEPA filters. These are filters that collect the very smallest particles, which are the ones that we find go deepest into the lungs. So you can you can find HEPA filters to put on your furnace, or on your vacuum cleaner, or your air conditioner, for example. We also recommend using products without additional scent when possible. Other things that you can do, as I mentioned earlier, quite often the paints that we use emit that new paint odor, but nowadays you can find paints that emit a lot less of the chemicals that we're worried about. You can buy no or low VOC paints. VOC stands for volatile organic compound, and that's the chemical in that new paint smell. So you can actually buy paints that release fewer of these harmful chemicals into the air. Obviously, you'd want to get a carbon monoxide detector, and you'd want to test for radon. Radon is an invisible radioactive gas that can get trapped into your building from underground, and exposure to it increases your risk of cancer. So we strongly recommend that facilities test for radon and mitigate if they find they have a high level of radon. Just like the American Academy of Pediatrics, we believe it's important to prevent children's exposure to pesticides when possible, as well as, of course, preventing their exposure to pests that can be asthma triggers or otherwise threaten their health. And there's an approach called integrated pest management, which helps you prevent pests in your facility while avoiding pesticide use unless absolutely necessary. And there are many resources that we'll talk about a little bit later that can help you with that. Obviously, removing asthma triggers like pets that have fur or feathers, and as I mentioned earlier, avoiding additional fragrances and scents. Rather than using an air freshener, so I often get asked, well, we have an odor in our facility, what kind of air freshener do we use? And the answer is the air freshener that you use is to find and remove the cause of the odor and to ventilate. If you use an air freshener, you are basically adding an additional layer of chemical on top of whatever that odor is. You're not really solving a problem. And then I'm going to talk also specifically about the issue of mold, because I know that is can be a problem in homes and in centers, and it's certainly something that we often get questions about as well. So I think the first thing to keep in mind is if you have a mold or mildew problem in your facility is to realize one thing. What you really have is a moisture problem. That means that you have too much moisture in the building, and so the first thing to do is to understand why you have the problem and to remove it. Maybe you have a mold problem because you had a one-time broken pipe, and fixing that is different than if the mold problem is because you have a slow leak in a pipe, or because you have a pipe that has condensation on it, or you have or you're not ventilating enough and you're having moisture build up in the kitchen or the bathroom. So if you don't understand the source of your mold or mildew problem and all you do is clean up after it, you're not really going to fix it. So the first thing to do is to find out the source of the moisture, and to fix water leaks promptly or reduce humidity. And this slide shows the examples of things that you can do. And so that's our recommendation to understanding and dealing with mold. And I see a question: how can we learn what air fresheners are okay? Our recommendation is not to use any air fresheners. I can't speak to the question also asked about a particular product that claims to eliminate odors. I can't speak to how that product works, but again, our recommendation is to basically mechanically find and remove the source of the odor rather than looking at other products that have some chemical means of either removing or covering up the odor. I do know I read an interesting article in the Consumer Reports magazine about that particular product, where aside from whether or not it actually eliminates odor, the consumers felt it really wasn't effective anyways. So here are some resources where you can find more information specifically about air quality indoors and outdoors. The Children's Environmental Health Network's Eco Healthy Childcare Program has a 2-page fact sheet that you can download for free. And also on that fact sheet, there are links to other resources, including this EPA Make Your House a Healthy Home program. And I want to also let you know, while you're thinking about these concepts and thinking about, well, why should I bother to address these exposures, or gee, this seems like a lot, gee, this seems overwhelming. There have been examples to show that it really does make a difference when you look at environmental health and addressing environmental exposures. For example, there's a program in Louisiana after Katrina where experts went to homes that had children with asthma, and they found that just doing a one-time environmental intervention, going through the house and helping to point out to the residents, here are some things that you can do to improve your indoor air quality, they saw a 50% decrease in asthma through environmental interventions. So I know that there are a lot of programs around the country today that are dealing with children with asthma, to making sure they have the appropriate medication plan and making sure that the people who care for them know how to identify an asthma attack and how to appropriately administer medications. And that's all really important. But I think it's also important to know that you may be able to actually maybe prevent some of these attacks by recognizing indoor air quality problems and eliminating triggers. So I put that in there just as an example of why I think it's worth it for you to understand and act on indoor air quality. I will just take a moment to say there's a question about essential oils. Is it okay to put essential oils in a water bottle to decrease diaper odor? And we actually earlier thought it was okay to use essential oils as an air freshener. And I'm not clear about in this question about once you put essential oils in the water bottle, what you do with them. But we've heard from people in the field that essential oils themselves can also be volatile organic compounds, and also, particularly the very sensitive children, can also trigger asthma attacks. So we agree with the American Lung Association and the American Academy of Pediatrics that the best practice is to avoid scented products in air fresheners, which unfortunately includes essential oils. As I said, we recommend other ways of dealing with odors. And I see someone else has put up a fact sheet about air fresheners. And as I said, we also have a fact sheet that you can also turn to for additional information. So this is the slide that I mentioned that was already earlier, talking about the different sources of indoor air pollution. And for each of the items that are listed in the regular in black font, we actually have individual fact sheets for each of those. We have a fact sheet about pests and pest control. We have a fact sheet about building materials and furnishings. So if you go to the Eco Healthy Childcare website that was mentioned earlier, and that will also be later in the presentation, you can download individual fact sheets about each of these items to get more information. And here's that website already. This is one of the I think can be a key resource for you for getting more information about environmental health and how to adopt better practices on environmental health in the child care setting. The core of the program is a 30 question checklist, which a child care facility can use to fill out and return to us and become endorsed by our program, and then 16 related fact sheets. And all these materials are free on the web. And as I mentioned earlier, everything we do is science-based. We have science advisors. The program is award-winning, and we also have advisors from all of the major actors in the field of childcare, as well as key government agencies. And these are the topics that are included on the fact sheet. And I'm going to just say, as an introduction to the program, as I said, one facet of the program is an endorsement program that a child care provider who adopts the best practices on our checklist, they can be endorsed. They would be endorsed for 2 years, and they would be posted on our website, and parents would be able to find them. So they would be recognized for their work in creating a healthier environment. And then another facet of our program is we offer trainings. We have a train the trainer, and we offer technical assistance to anyone. Anyone can call us up. And the National Center for Healthy Housing is also going to be offering our train the trainer with their training partners around the country. But as I mentioned earlier, we have a training and technical assistance component. We have this endorsement program. And of course, I would love for every child care provider to download our checklist and to fill it out and to send it in and become endorsed. But I also would be delighted for any child care provider to download our checklist and use it just to help them make changes, to help them move forward to provide a healthier environment. We think this is a really great program. It's practical. More than 2,200 facilities have already been endorsed by our program, and so we think it's a good one. But we are working very hard to just increase awareness of this field and these best practices and improve things for children around the country. And then again, just another reminder, because often when I talk to people about this, they feel a little overwhelmed. And is this really worth it? I already have so many things on my plate to do. And if you can improve the health of the children in your facility, if you can improve their ability to learn and help them a healthier future, I think that's worth it. And I think that this one example from Louisiana, and there are others we can offer, I think shows that it is that understanding and making change really is worth it. And the bottom line is, when you provide a healthy environment, the children in your care are smarter and healthier, and it is something that you can do. So with that, I'm going to turn it over to Linda, and we'll be back to answer questions at the end.
Carol, I want to thank you so much for your presentation. There were a lot of helpful hints and a lot of good information. I'm happy to be able to share with everyone. As Carol mentioned earlier, I'm going to speak a little bit, but before that, I want to recognize the initiative that allowed the collaboration, including this webinar, to happen. The Children's Environmental Health Network was provided with an opportunity through an initiative with the Centers for Disease Control and Prevention to provide technical assistance around ensuring healthier environments for children in early care and education settings. The National Resource Center was chosen to partner with CEHN, the Children's Environmental Health Network, to try to ensure that all children in early care and education environments are in environmentally healthy settings. Certainly thanks CEHN for this opportunity, as well as the CDC. It's important to know the mission of the National Resource Center, and it's very easy to see that this project fit nicely with the mission. While the NRC does certainly not only focus on environmental health, it is certainly included in an important part of our mission statement. We want to improve the quality for all children in out-of-home settings so that their health and safety is certainly. We absolutely follow this mission very closely, and we do this by supporting a variety of audiences and stakeholders, nationally and within states. For Early Head Start and Head Start, and those of you that work with Head Start programs, there is an online crosswalk available that talks about how the Head Start performance standards and the CFO 3 standards are crosswalked or intermingled. For home visitors, we also have a home visitor page on our website that compiles all of our resources that might be relevant for this group. And again, we have resources and relationships with a wide variety of people. Caring for our children is our primary resource, and hopefully many of you on this call are very familiar with this resource. Just a reminder, it is a collection of 686 National Health and Safety Performance Standards for early care and education programs. This document is co-published by the American Academy of Pediatrics, the American Public Health Association, and the National Resource Center. We also receive support from the Maternal Child Health Bureau. 1992 was the very first edition of Caring for Our Children. In 2000, the second edition came out. In the third edition, as you can see, the standards were not developed and revised solely by the NRC, and instead we partner with a wide variety of national experts. The third edition was completed and published in 2011, and it was a very lengthy revision process, as you can see. The 10 technical panels and all of their experts were very, very important in advising the NRC and our other content experts on the standards and what they should say. Again, as hopefully you know, the Caring for Our Children third edition is a nationally recognized resource. In earlier editions, we found that many of our standards were mainly consensus. But as more and more research has become available and become conducted in child care, there is more evidence-based material now to back up the standards. And I think Carol certainly referenced a lot of the information and a lot of the research that's being done that allows us to say some of the things we say in our environmental standards. Caring for Our Children standards are voluntary. They are not regulation. But they have been used by many, and it's certainly one of the main purposes of the resource, to produce model regulations and policies for health and safety throughout the country. As you can see, there were many key partners involved in the development of the standards. Our first group are the partners that I had mentioned earlier. We also have a very active steering committee made up of members of our partnership. We work with technical panels, and these panels are arranged by topic areas. For example, environmental health, injury prevention, child abuse, nutrition. Group 4 are stakeholders. These represent those people that we serve, and I discussed those in the previous slide. We had many parents and guardians, many early care and education program caregivers and teachers. We've had health professionals. We've had Head Start and Early Head Start professionals, regulators, licensors, all be part of the review and part of the input into the Caring for Our Children standards. This is a process that we feel makes our standards very robust and very transferable throughout the country. Again, a brief review. These are the chapters that are contained in Caring for Our Children, the third edition. As you can see, Chapter 5 contains the majority of the standards that deal with environmental health. Although, just a preview, I will let you know that there were standards throughout all of caring for our children that do impact environmental health. Up until about 2 years ago, in addition to the print copy of Caring for Our Children, there was a PDF version available. We now have a searchable database, and I do want to feature this and make sure folks are aware of this. Right under the block that has the letters NRC, there's a place on our website for you to put in any topic that you would want to search. And in fact, this database was used when we were trying to take a look at standards we might want to compile for different collections that we've had. For example, when we did the infant-toddler collection, by typing in infant-toddler, I could get a view of all of those standards that impact the infant and toddler population. So it's a very easy way to go back into that whole big volume of standards and do the search. If you have any questions about how to use the database or need any help in finding standards, please always feel free to contact our 1-800 number or email us at info@nrckids.org. And that information appears on the bottom of each of the slides. In addition to the publication that includes all the standards caring for our children, the NRC has compiled several special collections, and these are included on the current slide. I want to highlight a couple of the more recent collections. In the upper left-hand corner is Stepping Stones to Caring for Our Children, 3rd edition. This collection was created last year and represents those 138 essential standards that when practiced could prevent serious adverse outcomes to children in early care settings. Caring for Infants and Toddlers on the lower right-hand side is our most recent collection. This collection was launched in March of this year, and as the title infers, represents those standards most applicable to the infant-toddler population. And we just received a request this morning from Virginia to be able to print or to be able to make copies of about 170 of the infant and toddler collection to share with the providers throughout their state. We're really happy to see that particular request come in. Coming soon is the Environmental Health Collection, so Environmental Health in Early Care and Education. As the NRC was trying to determine other potential collection subject areas, the opportunity to partner and collaborate with CEHN was presented to us. This happened early this year. The result of that collaboration, as I've mentioned, is one of the results is the webinar, and then this collection that will come out in late summer. We began work on the collection in March, and again it will be available in late summer. That process I described to you earlier of talking with our steering committee, with stakeholders, with reviewers, with technical panels, that is all part of creating a collection as well. And so that process again began in March and will culminate in the collection that will be out at the end of summer. We certainly also encourage you to check our website for the other products. All the products that I've talked about, all of those collections are available on our website. The slide here tells you exactly how to get there from our website, and we certainly would like you to check those out and certainly stay tuned for the Environmental Health Collection launch that will happen at the end of summer. I just want to thank everyone so much for your participation today. And Jean, I will turn things over to you and complete our webinar.
Well, thank you, Carol and Linda, for that wonderful presentation. Right here. Sorry, we're having, there we go. We obviously don't do this alone, both at the CEHN and the NRC, and we have many folks who support our efforts. And those top 7 agencies are strong supporters of the Children's Environmental Health Network. And those bottom 3, the American Academy of Pediatrics and American Public Health Association are our co-publishers for the Caring for Our Children 3rd edition standards. And then the Maternal and Child Health Bureau support us through a federal grant, and so we always like to thank them for their support. And last but certainly not least, we want to thank all of you for being advocates and supporters of providing healthy and safe environments for young children in out-of-home settings, as well as spending your afternoon with us. So thank you very much. We're just going to go through a couple housekeeping things before we get to any questions you might have. As is the case with any presentation, we always love to hear your feedback about the process, about the information we shared, and so we are going to invite you to take a short SurveyMonkey evaluation. Those will be going out this afternoon after the webinar is over. If you haven't received it by tomorrow, please do check your spam. It will be coming from the info@nrckids.org email. So please keep an eye out for that. We really welcome your feedback. And then for those of you who are interested in receiving a contact hour certificate for participating in this webinar, that information will be in that same email. So please keep an eye out for that. I also just wanted to mention that this webinar is being recorded, and we will eventually have it up on both our website as well as the Children's Environmental Health Network's website. The complete presentation will be there, so keep an eye out for that, and we will certainly announce it through our social media networks. So if you're not part of that, I invite you to like us on Facebook and follow us on Twitter. And then also, per the request of someone earlier in the webinar, we will be sending out a PDF of this slide presentation. And we'll just go ahead and include that in the evaluation email. So you'll get an email with lots of information from us shortly after this is over. For those of you who may have questions after this webinar is over, this is our contact information. Children's Environmental Health Network is on the left there. Hester Paul is based in Oregon, and Carol Strobel is based in Washington, D.C., and that's their contact information. And the NRC, there's lots of ways to get in touch with us. You'll see that on the right. Our website includes all of our resources and products. We have a toll-free 1-800 line that you can call at any time, our info email. Again, there is our link for our database that Linda shared with you. And then we also have an e-resources email that goes out every other week, and it just has some internal things that are going on at the NRC, like if we have a new resource or news from us, as well as external resources and conferences, webinars, things like that. So I encourage you to sign up for that. And with that, I think I'm just going to invite anyone who has questions to please type it in the chat box, and either myself, Linda, or Carol would be happy to answer those for you.
Hi. Well, hopefully while folks are typing, this is Carol. I wanted to just thank Linda and Jean and the NRC for all their help, both this webinar, but we are also very, very excited about the Environmental Health Collection. We think it'll be a great resource for many, many audiences and people, and we're very grateful for all the time and effort that they and their volunteers are putting in to make this happen.
Likewise, Carol. We are really excited also and happy to be partnering with you all. So thank you.
Great, thank you. And I will say, I just touched upon this earlier, but for those who want to find more information out or learn more, as I said, we have a Train the Trainer, and you can contact us to see when we may be offering that in your area. But we have also already offered this in a number of states, so that you may actually find someone who has attended our Train the Trainer who will be offering individual trainings on different topics as well. And so you may find someone already in your own state who will be offering sessions that you can attend.
Thank you, Shannon. Am I pronouncing your name correctly? Absolutely. Please do.
Hi, Shannon. That's Shannon Medlock. She just put a lot of work in supporting me and going to Montgomery, Alabama to do a very fun Train the Trainer there. So thank you, Shannon. It's nice to see you. And there's a question, what technical assistance might we provide about air purifiers? actually, if you contact us or look on our resource guide on air quality, I think we can point you towards some information that EPA offers. There are some air purifiers that have HEPA filters that really can help improve air quality. There's actually one study I didn't mention, similar to the one in Louisiana. There's a study in Baltimore where they found that putting in a good quality air purifier also decreased asthma symptoms by a third. However, some air purifiers, or what they claim to be air purifiers, like the type that emit ozone, those are ones that we would be concerned about because ozone at ground level is not healthy. So there are resources that you can either contact us or look on the EPA website to find out more about what good quality air purifiers are. An EPA website that's a very good resource is www.epa.gov/childcare. I'll type that in the chat list right now. We often get a lot of questions about bleach and cleaning products. Again, if you go to our household chemicals fact sheet, that has a lot of information about bleach, and it also will direct you to, or you can contact me directly. I can direct you to a fabulous resource, a huge toolkit called Green Cleaning in Childcare that has been put out by a variety of organizations such as UC Berkeley and others, and has a lot of information about alternatives to bleach or using bleach appropriately. And so if you give me a moment to put down the microphone, I'll type in a few things in the chat box so everybody can see that. Any other questions?
This is Jean again from the NRC. If there are no other questions, I think we can say good afternoon, and you all can look forward to that email from us. I'll just give you one more chance to type in a question if you have one. Oh, here comes one. Thank you. Well, again, I just want to thank you all for taking time out of your busy day to join us. And Carol, did you have any other closing remarks?
I just want to thank everyone for taking time out of their busy schedule. We hope we can be a resource for you. And thank you very much.
Thank you all. Have a good day.